My name is Ashley Rogerson, and I'm an adult orthopedic spine surgeon at University of Rochester Medical Center. My area of expertise is in adult orthopedic spine surgery, where we take care of really a wide variety of spine pathology, ranging from traumas that come in through the emergency department to routine degenerative conditions that can, like spinal stenosis or disc herniations, that can cause pain and limit function. And we see those patients electively in the office and treat them from there. I knew going into medical school that I wanted to strongly consider a career in surgery. And then as I was going through my clinical rotations, I did an elective in orthopedics, and I found the cases to be really cool. The trauma patients that come in with broken limbs that you can fix and then they're up and walking the next day. Those were some of the early cases that I got to see and participate in as a medical student that kind of turned me on to orthopedics. I see people all the time that are really limited by back pain, leg pain, neck pain, arm pain, then they aren't able to be active, and they aren't able to either work or exercise or take care of their grandkids, and getting their pain to a manageable level where they can be active is the most rewarding part of my job, I think. The new orthopedic center at Marketplace is really like the epitome of orthopedic care. We have everything from operating rooms to advanced imaging, a beautiful clinic tower where we can see hundreds of patients a day, and tons of research opportunities in our motion lab. There's a huge benefit to patients to having all of your orthopedic care in one place. And certainly we still have satellite clinics all over the Rochester area to bring routine care closer to home. But one of the huge benefits, especially from a spine standpoint, is just the collaboration that we have and the ability to go over to our non-operative colleagues, and just the ease of communication between departments and between our faculty is really important, and it can save patients an extra visit that they may not have to have, and it can expedite care for certain conditions when it's necessary. I'm proud to go there and work there.